For a lot of voters, the central issue in this election campaign is the condition of our most loved institution, the National Health Service. But these have not been easy years for the NHS or those working in it, and the Health Secretary responsible for the NHS in England may have his work cut out, explaining why its future will be brighter under the Tories, and he joins me now. Good morning. We tend to bandy numbers a lot in these conversations. Let me start with a very simple question, which is, if I wake up in the middle of the night and I've got some pain inside me and I'm rushed to A&E, how soon should I be seen?
Well, the standard says that you should be seen within 4 hours, not just seen, but also treated and either discharged home or admitted to hospital.
Okay. When was the last time the NHS in England hit that target?
Well, we haven't hit it for over 2 years.
Because another good example of how the NHS is performing or not performing is the 18-week rule, which is that, again, if I'm in a GP's surgery, he says, I'm terribly sorry, Mr. Marr, there's something serious happened to you. You have to go into hospital for an operation or some kind of procedure. I will be seen within 18, I'll be there within 18 weeks. And again, can you remind us how many people are not seen within 18 weeks at the moment?
Well, the standard is 92%, and currently we are on 90%.
But those are both two rules that you set yourself, the 4-week rule and the 18-week, the 4-hour rule and the 18-week rule, to be judged by, and you have failed on both of them.
But then
370,000 people are now not seen within 18 weeks, and that number is going up very fast, 100,000 in the last year alone. Here is the Royal College of Physicians saying our NHS is underfunded, underdoctored and overstretched. Patients are waiting longer on lists, on trolleys, in emergency departments and in their homes for the care they need. An increasing number of people, although clinically ready to go home, cannot safely leave hospital as the care system is unable to cope. People's lives are being put at risk. That's the Royal College of Physicians. That's not the BBC or anybody else. It's a very, very serious assessment of where the NHS is under Jeremy Hunt. And you've got a real problem of pay in the NHS. Nurses who have had 7 years of pay freeze. I put it to the Prime Minister that the Royal College of Nursing says that nurses are having to go to food banks at the moment. And she said there were complex reasons why people go to food banks. Are there complex reasons why nurses have to go to food banks?
Well, let's look at the facts. The minimum a nurse can be paid in this country is £22,000, £27,000 in inner London. If you want more money to go into the NHS, then the question is how you get there. And there is a non-NHS issue that overshadows everything, which is the Brexit negotiations. And I'm sorry to come to this, but it's very, very important.
I'm delighted you're coming to it.
Because if we don't get a good Brexit outcome, if we get a bad Brexit outcome, that would be a disaster for the NHS.